Hello, we are going to do the last two modules of the CANS, which are called placement modules. So the residential treatment center is completed when the child is at an RTC, and the current caregiver is completed when the child is in foster care. So let's look at the residential treatment center module, and the first item is investment in treatment. 0, the child accepts the reality that he's in treatment and may even acknowledge the need for positive change in his life. And 1, sometimes voices the desire to be elsewhere, but we don't know if this is associated with temporary misbehavior or negative mood. In 2, there's a routine desire to be elsewhere and is associated with acting out behaviors or persistently negative mood. In 3, child shows high-risk acting out behaviors or an extremely persistent and distressed mood related to being in the current treatment environment. So he acts out or acts in. The next item is community offsite behavior, and this is how the child behaves when they are out in the community. We're rating past 30 days, of course, in all of the items in this module. 0, often or always meets expectations for socially appropriate behaviors during community-based activities with staff and peers. 1, needs occasional redirection, encouragement, or limit setting in those occasions. 2, requires frequent redirection, encouragement, or limit setting in those situations. And 3, the activities of the child have been greatly restricted due to the high likelihood of risky, unacceptable, or disruptive behaviors when he's in the community. Next item is home visits. And 0, home visits are occurring with few or no obstacles. 1, mild concern due to parent-child relationship status, transportation arrangements, potentially risky child behaviors away from a structured setting, parenting weaknesses, or similar concerns. Or the home visits have not occurred yet, but there's no cause for concern. In 2, the same concerns as are in 1 are present, or one of them, but they have a different level. They are moderate concerns. And in 3, there are serious concerns about all those issues, or there's no caregiver identified, or no home visits are occurring or planned. The next item is caregiver participation. In 0, adequate to good participation by caregiver in family-related interventions. In 1, the caregiver occasionally misses family-related services but is communicating with staff, is open to receiving support, education, and information. In 2, the caregiver is under-involved with family-related services or is uncooperative with the program. In 3, the caregiver is nearly or completely absent from all family-related treatment services and is communicating a desire to not participating in the child's treatment program. Or, like in the above item, there's no caregiver or parent figure currently identified. The next item is called caregiver-child interaction. In 0, the child and the parent are relating in a reasonably safe, caring, and/or stable manner. In 1, sometimes they relate in unhealthy or unstable ways, but most of the time the relationship is adequate at this stage of treatment. In 2, they have a pattern of interacting in unhealthy or unstable ways, which is more impaired than expected for this stage of treatment. In 3, the child and parent have extremely unhealthy or unstable interactions, which are much more impaired than expected for this stage of treatment. And or in 3, we would have no caregiver involved, meaning that children would score a 3 in any of the 3 items that we just saw, either home visits or caregiver participation or caregiver and child interaction, if there is no caregiver involved. The next item is progress towards goals, and that's exactly what it means. We continue to rate the past 30 days. 0, satisfactory to good rate of progress toward treatment goals and objectives. In 1, somewhat slow and inconsistent, but there are improvements occurring. In 2, moderately slow in achieving goals and objectives. And it's not easy. It's not easy to identify improvement from week to week. In 3, there's no identifiable progress, or he's regressing over weeks or months. And the last item in the module of Residential Treatment Center is preparation for discharge, rightfully so. 0 is ready for discharge. 1, nearly ready, but some concerns remain. 2, not yet ready. But there's a discharge setting identified where treatment can continue and should continue because there are serious concerns that remain. In 3, this is serious and requires immediate action because the child is not ready and no discharge setting has been identified. So requires immediate action. The last module is called Current Caregiver, and it refers to foster placement. This module should be completed for all children placed in a foster home and or with a surrogate caregiver. The first item is supervision. 0, caregiver has good monitoring and discipline skills. 1, caregiver provides generally adequate supervision, may need occasional help or technical assistance. 2, caregiver reports difficulties monitoring or disciplining the child, needs assistance to improve supervision skills. And 3, unable to monitor or discipline the child, requires immediate and continuing assistance, and the child is at risk of harm due to the absence of supervision. If you remember, this is exactly the same scoring as for the planned permanent caregiver. The next one is involvement with care. Past 30 days. 0, caregiver actively involved in planning or implementation of services and able to act as an effective advocate for the child. In 1, caregiver has a history of seeking help for their children. Caregiver is open to receiving support, education, and information. In 2, the caregiver does not wish to participate in services or interventions intended to assist their child. In 3, the caregiver wishes for the child to be removed from their care or is not visiting the child in residential care. The next item is knowledge. 0, caregiver knowledgeable about the child's needs and strengths. 1, generally knowledgeable about the child but may require additional information to improve their capacity to parent. 2, clearly needs information to improve how knowledgeable they are about the child, and that current lack of information is interfering with their ability to parent. And in 3, that lack of knowledge places the child at risk of significant negative outcomes. You can see how these items are the same as with the planned permanent caregiver. The next item is organization. 0, caregiver is well organized and efficient. 1, minimal difficulties with organizing and maintaining household to support needed services. For example, maybe forgetful about appointments or fails to return a phone call. 2, moderate difficulty organizing and maintaining household. And 3, unable to organize household to support needed services. Social resources. 0, significant family and social network that actively helps with raising the child. 1, some family or social network that actively helps with raising the child. And 2, there is family or social network that may be able to help with raising the child, but they don't do it. 3, caregiver has no family or social network that may be able to help with raising the child. Next item is physical health of the caregiver. 0, generally healthy. 1, in recovery for medical or physical problems. 2, medical physical problems that interfere with capacity to parent. And 3, medical physical problems that make it impossible for them to parent at this time. And finally, the last item of this module is family stress. And it refers to the stress of parenting this child or the child's needs. So 0, caregiver able to manage the stress of child's needs. 1, some problems managing the stress of the child's needs. 2, notable problems managing the stress of child's needs. This stress interferes with their capacity to give care. And 3, caregiver is unable to manage the stress associated with the child or children's needs. This stress prevents caregiver from parenting. And with this last module, we have completed all of the modules of the CANS and the supplemental modules.